Joining us now is Chiquita Brooks-LaSure. She is the administrator for the Centers for Medicare and Medicaid. Ms. LaSure, thank you so much for joining us.
Thank you for having me.
Two big announcements this week from CMS. One about the coverage of home tests for COVID testing, and the second about the coverage of the Biogen Alzheimer's drug, Aduhelm. And I want to start there. You are limiting the coverage, issuing a rare limitation called the coverage with evidence development. What went into that decision?
Thank you so much again, Bertha, for having me and giving me the opportunity to talk about this exciting development. As we know, Alzheimer's is just such a heartbreaking disease, both for the people who have it as well as for the families that care for them. The process that we go through at CMS to determine what drugs will be covered is an evidence-based process. We have the responsibility of making sure that it's appropriate for the Medicare population. And what we've done here is had a lot of stakeholder discussion. We had two national stakeholder meetings and have our team of clinicians and scientists reviewed the evidence and decided that we would indeed allow Medicare to cover both Aduhelm as well as other drugs within the same class within the context of a clinical trial.
So you have a number of the nation's premier health systems that have said they are not going to provide Aduhelm to their patients. You also had, the Alzheimer's Association also say they questioned the need for this for all sorts of patients. But you do have critics. Us Against Alzheimer's came out saying that they felt that CMS was taking a different tack on an FDA-approved drug than they would for, say, cancer or for HIV. And they feel that this might actually be difficult for older folks experiencing dementia and Alzheimer's. What do you say to that?
I say that we at CMS take our role and our responsibility very seriously. We do want to make sure that that in the context of a clinical trial that people receive coverage. I would add that this is a proposed determination, that we have a 30-day comment period. We welcome stakeholders inviting comment, and we will release a final determination later. But I would just again emphasize that we really want to make sure that it's appropriate for the Medicare population. And that's some of the reasons why we've outlined, our team outlined things that we want to see in the clinical trials, making sure that the population reflects the Medicare population, which is a very important component to the trials that we want to see moving forward.
You know, one of the things that you talk a lot about is making sure that CMS promotes health equity. And one of the areas that we've seen real difficulty, and there's sort of the haves and have-nots, has been on home testing. This week, you issued rules to insurers that they must now cover home testing, at least 8 tests, individual tests per person per month. Yet the insurers got the rules on Monday, and talking to them yesterday, they were still trying to develop just how they were going to do this. Are you worried about how this rolls out, given that it begins on Saturday?
It does begin very soon. As you know, the president announced this in December, and since then, our team has really been trying to work with insurers, listening to their concerns, and really tried to incorporate that in the rules that we set forth. We are really working round the clock as an administration to address the COVID-19 pandemic and feel like testing is a big part of that. And so we are really confident in our strong relationship with insurers to help them implement this guidance, knowing just how critical it is for people to get access to tests. And so we're really encouraging them to develop partnerships with pharmacies, which are the backbone of our healthcare system in so many respects. And if they're not able to do that, people can also have a process where they get reimbursed by their insurer. And that, again, starts, as you said, on Saturday, January 15th.
Chiquita Brooks-LaSour, thank you for choosing CNBC for your first television interview. We hope to continue this relationship and have you on again.
Thank you so much. It was a pleasure to be here.
Shepard Smith here. Thanks for watching CNBC on YouTube.